many of us believe we could take better care of ourselves? I think probably most of us. I know I could exercise better, eat a bit healthier, and especially sleep more. So why is taking better care of ourselves so challenging? What if we had the ability to help each other be healthier? These are really important questions because collectively we are getting sicker and sicker. Our unhealthy habits are exploding into epidemics of obesity, diabetes, heart disease, depression, and arthritis. That's where I come in, that last one, arthritis. As an orthopedic surgeon, people come to see me because they have knee pain from arthritis. And pain is so not good. Pain makes us suffer, and it keeps us from doing things that bring us joy. A lot of my patients are women, because women suffer more from knee arthritis than men do. And some have disease that's so severe that surgery makes sense. But for many, their knee pain would improve with weight loss and increasing their level of physical activity. And we talk about them doing those things. But you know what often happens? They come back to see me and their knee pain is worse. And although I know how difficult healthy change can be, there are days when I find myself feeling like I am failing my patients. I mean, what kind of doctor am I when I can't help my patients improve? The reality is that our healthcare system, the system that I'm a part of, typically fails to support patients on a journey towards wellness. Last year, 1.1 million knee replacement surgeries were performed in this country. I performed some of them. That's a lot of knee replacement surgery. And in 2040, that number is projected to be a staggering 3.4 million. I mean, honestly, I can't even fathom it. We are certainly not supporting patients on a journey towards less arthritis. And I could share other frightening numbers related to obesity, diabetes, heart disease, and other conditions. So I decided to study this problem. And I asked myself, what is it that makes us healthy? I was surprised at what I learned. You might be too. It turns out only 11% of our health and well-being is actually related to medical care, the kind of work that I do. Now that's not very much, but it is a critical component if you need it, like if you're having chest pain or you broke a bone. Environmental and social factors contribute 7% and 24% to our health and well-being. If you live in an area where the air is bad, chances are more likely you'll suffer from asthma. If you live in a food desert, a neighborhood where there's no grocery store, it's harder to eat healthy. We are starting to recognize more and more how these social determinants of health are impacted by systemic discrimination and structural racism. Important topics that I don't have time to discuss today, but are worthy of their own TED Talk. Genetics contributes 22% to our health and well-being. That makes sense. Family history matters. It makes us more or less susceptible to certain diseases. But the largest contributor to our health and well-being is our individual behavior at 36%. And I thought to myself, now that's something each of us can influence, and influence now. So I turned to an organization committed to health equity, and I asked, is there something we can do to support individuals in making healthy behavior change? We brainstormed on possible solutions. Quite honestly, we didn't know what would work or exactly what to do, but what we did know is that the current system is failing to improve health in so many of our communities. We started by asking ourselves, what do we think the key to health is? We realized it's movement. You see, when you develop joint pain, which is so common, we decrease our mobility because the joint hurts, so we don't want to use it. So that lowers our level of physical activity, promoting weight gain and obesity, which then puts more pressure on the joint, causing more pain, more functional limitations, more obesity, ultimately resulting in severe arthritis. But that's not the only thing that happens, because with the development of obesity and lack of physical activity comes the development of heart disease, diabetes, and depression. In other words, a person who has serious medical illnesses. We see that the key to breaking this vicious cycle is movement. Movement helps keep our joint healthy. It helps us control our weight and our blood pressure and our blood sugar. And movement is so powerful in helping our mental and spiritual health. Movement is truly powerful. We also know that women are more likely to suffer from knee arthritis than men, and women are also more likely to get trapped in this vicious cycle. So we asked ourselves, is there something we can do to support obese women with knee pain adopt healthier behaviors? The answer is yes. We created an 18-week community-based program for these women. We wondered if they would feel more comfortable grouped together with other women of similar backgrounds, so we kept that in mind when we created the groups. Each week, 40 or so women would come together for 3 hours. And the first hour would be educational in nature, with a topic like nutrition or diabetes or arthritis. And the second hour would be movement, like line dancing or yoga. And the third hour would be in smaller groups for motivational interviewing to really help these women understand what are their personal barriers to adopting healthy behavior change. I'm excited to share that our program works surprisingly well, but maybe not for the reasons you think. It wasn't because our health information was better. These women could have gotten the same information from their own healthcare providers or even the internet. It wasn't because we provided access to medical care, because we didn't. We did not increase funding for local social programs or solve food security or safety issues in their neighborhood. All those efforts are still needed. It was because our program created the opportunity for these women to make the emotional connections with other women that would support them on a journey towards better health. Instead of treating these women as individuals, we treated them as a community. We gave them the tools and created the community so they could support one another. In our 5 programs to date, over 200 women with an average body weight of over 190 pounds have made remarkable improvements in their health in just 18 weeks. They've lost 3% of their body weight, decreased their knee pain by 35%, and increased their walking speed by an amazing 18%, reflecting greater movement and less pain. And perhaps what I think is most impactful, their feelings of hopelessness, yes, hopelessness, decreased by nearly 40%, all without drugs, injections, or medical intervention. Wow. So I want to share with you our 3 biggest takeaways from our program. Some were unexpected. First, when we asked the women, what did you like best about the program? We expected we'd hear, well, my knee hurts less, or I'm feeling more hopeful. Instead, the women talked about, and we did hear those things, but what the women talked about so much more was the relationships they formed with each other. We repeatedly heard, we lift each other up. These women are now my sisters. We even heard, this program saved my life. The biggest need in our world to improve health isn't more medical education or access to care, although those things matter. The biggest need is emotional connection. Illness can be transformed to wellness when we move from I to we. Emotional connection to others gives people the support they need to make healthy behavior change. Our second takeaway, these women became health promoters. They didn't just cook better meals for themselves, they also did so for their children and their partners. And their children will grow up healthier because one woman was in a community of other women and they supported each other on a journey towards better health. If you can improve the health of women in your community, you can improve the health of your community for generations to come. Our third takeaway, healthy habits are best adapted within culture. Though the principles were the same, we believe success of our program was promoted by grouping the women together by background. This allowed nutritional classes to focus on foods they were familiar with, music and the movement classes to be culturally aligned, and perhaps a greater sense of psychological safety in the motivational interviewing sessions, because these women saw other women who looked like them. This program has been one of the most rewarding activities of my professional career. It changed me. This journey has taught me something about our responsibility and privilege as individuals to shape the health of those around us. I now think of healthcare differently. I see an opportunity for us to move forward and improve health in our communities in ways I didn't see before. Please understand, I am not saying that we can ignore the systemic discrimination or structural racism that creates health disparities. Of course, these need addressed. But what I am saying is that we need to leave sick care in the doctor's office where it belongs and move wellness promotion into the community where it can work. And it works in the community because of the relationships formed between people. It is just as simple and as beautiful as that. Communities come in many shapes and sizes, and we're all members of various communities, although we may not always appreciate that. Communities can be a church, a neighborhood, or just a group of people somehow connected to each other. Communities allow the influence of our culture and genders, powerful forces as we saw in supporting behavior change in our program. My goal is for organizations listening, whether you're related to government, business, churches, neighborhoods, is to see the people they serve not just as individuals, but as communities of people who can lift each other up and combat the emotional isolation so common to those with chronic illnesses. This will improve health. And for you individuals listening, here's the one big thing I'd like to leave you with. The single most powerful force to shape the health of our nation isn't doctors like me or education. It's you. While my credentials make me a healthcare provider, the real power to shape the health of those around us lies with you as a health promoter. Small things can make a difference and add up. As a health promoter, you could get everyone out for a stroll after dinner, do FaceTime with your best friend while you're taking a walk. You could bring a healthy dish to the potluck, or simply include more fruits and vegetables in your family meals. What if you asked people at work to take a 10-minute walk with you over lunchtime? Movement is powerful. I invite each of us to embrace our power as health promoters in our own ways, in our own communities, and for our own culture and values. We can make a difference today. And when we embrace our power as health promoters, we will elevate humanity with more emotionally and socially connected people who will be happier and healthier. Thank you.